Welcome to Legalized Negligence, where we discussed Florida Statute 768.21, subsection 8. And tonight we want to do a kind of short podcast on FOIA requests. A lot of people hear about them. They've heard what they are, but I don't know that they know what they are or how important they are to helping to prove your case and get information from the state. So Travis is kind of an expert at these. He's filed so many of them. So I'm going to kind of turn it over to him. First off, I'm Philip and this is Travis. And neither one of us are attorneys. We're both just guys who are trying to fight our way through the system in Florida to seek justice for um, our moms dying of medical malpractice. So, Travis, go ahead and I guess we can start by me just asking you exactly what is a FOIA request.
Okay, FOIA is a Freedom of Information Act request, and there's federal law for it, and Florida has what's called a sunshine law, and it covers a lot of entities, of government entities making things public. There are items specified in, I think, Chapter 119 of Florida statutes that will exclude certain data from being accessible to the public. But in the most part, it gets you public records.
So this is the state's way of being transparent to the citizens.
Correct.
And we have to request information, but it's real important to know what kind of information that we can request and know how to use that information, to get where we want to go. So why don't you give us an example of why you have filled out FOIA requests in the past?
Okay. I was looking for the lease agreement on a hospital because I went to the property appraiser's office and found that the county owned the property still. And I wanted to know if they were a tenant, what the agreement was between the county and the hospital. So I went to Hillsborough County, I filed a FOIA, and they provided the lease agreements, which that also posed more questions. So you end up filing yet another FOIA. With medical, see, medical, a lot of it falls under 119. But what you can find are some of the rules or policies of the Department of Health. And I have some going right now regarding that. One example was I wanted to be able to prove on government letterhead that says, or that shows the rights we have in civil court are not covered by a Department of Health action. So I FOIA'd the Department of Health and asked them specifically the things that we can recover in civil litigation. Can you, do y'all go after that? And not those words, but pretty much they said, no, they can only affect the license of the licensee. They cannot do any recovery of expenses or anything like that. They don't do anything to the person, only to the license.
But like a real simple request, and correct me if I'm wrong here, but like, let's say that I was curious and wanted to know how many claims of medical malpractice have been filed in the state of Florida in a particular year or a period of years. That's something that I would have to fill out a FOIA request for.
Correct.
Okay.
Correct. Now, those are claims. Those are claims of medical malpractice, not necessarily, determined to be medical malpractice.
Right.
But yes, you can file that, and you would just have to do a follow-up question, or at the same time, and say, please provide documents sufficient to show how many medical malpractice determinations have there been within a certain amount of time.
Right.
And the way you ask is very important, because you cannot cause the governmental agency to create a report. They can only give you documentation that already exists.
Right.
So the wording is very important. I always use, please provide documents sufficient to show. It's up to them to choose the documents or whatever, but the end result has to be sufficient to show what my question is. I was getting turned down a lot just by asking a normal question. And then one day I was educated, and things started happening after that.
Yeah, and it's not just the information that we get from them in those requests, it's putting the government on record. The government has told me that, and I have the documentation to prove that there are X number of doctors in the state of Florida during this period of time, and there have been X number of malpractice case claims filed in this period of time, and there has been X number of doctors disciplined for medical malpractice by the state of Florida. So they're going on record when they provide that to us, and that's data that we can use later in our arguments to the legislature. Is that correct?
Correct.
Okay.
That is correct. And actually, today I filed with the Florida Department of Law Enforcement a FOIA requesting how many referrals to the department has the Department of Health made. Because I'm sure there's some doctors that break the law,
Yeah.
Criminally.
Right.
And I want to see, is the Department of Health referring them to law enforcement or not? So I did a FOIA. Just did it today. It's going to take a while to come back, but it'll be interesting to see what happens.
Well, can you walk us through a simple request? Like, where do you go? What website do you look for? Are there different websites for different agencies? And just kind of take us through a real simple one. And then once people understand the basics of the process, they can get, deeper into it if they want to.
Okay, let me share my screen here. You have it up?
It should be popping up here in a minute.
All right.
It might be, you said earlier that your computer was lagging a little bit. I'm not seeing it yet.
It is. I have a lot of tabs open. I keep a lot open. But also Google is your friend. Just always do, the agency you're looking for, and then put FOIA after it and see what shows up. 9 out of 10 times you'll find it in the first page of results.
It seems to me like the research I've had to do over the last 3.5 years, mainly I'm going to be dealing with ACA and the Department of Health. Now, I also had to deal with the Department of Children and Families because I reported the nurse for neglect. She had a responsibility to follow safety protocol at the hospital, and she ignored it. So I initially filed with the Department of Children and Families. And then from that, once I got their report back, then I went to the Department of Health with it. It looks like it's trying to load now. It ought to be here in a minute. But those are,
yeah, worst comes to worst,
I think those are the two.
I can always paste in the chat the links and send them to you if need be.
I think those are the two. There it is. It just popped up on my screen. So
Okay.
this is the template that you keep on your computer when you start out a FOIA request.
Yeah, this is pretty much how I always ask my questions. Please provide documents sufficient to show, and then whatever you want.
Okay.
Just take the ellipses out and change it to your question.
Okay.
Here's the website right here for Department of Health, floridahealth.gov, about /sunshine /info /public-records-request. I would say Google it. It'll come up. Click here to hit the submit request, but you can also mail them in and do an email of your request. But what they will do is they will email you the response, in which case you'll still need to set up an account.
Mhm.
Unless within your request you specify the method of delivery, which would be postal mail if you didn't want to set up the account.
Okay. So somebody could.
Once you log Once you log in, you'll get this page, in which case you can submit a new request right here. And just start typing. Anything you want.
You know, we don't have to submit it. I know we're just doing, an example.
Okay.
But, you could say, would like to know how many doctors have been, and can you be specific to a hospital?
Oh, absolutely.
Okay, so,
Absolutely, you can.
all right, my mom was in Winter Haven Hospital. So, I could say, please show me how, uh, please provide documents sufficient to show the number of doctors who were disciplined from Winter Haven Hospital during this time period. Is that
Correct.
okay?
That you can ask it. And now what you may get is a reference to the license verification portion of the Department of Health's website, in
Mhm.
which case they'll tell you you can do the search yourself. We make it publicly available.
Okay.
That's happened quite a bit. Not always fulfilling the exact question. I kind of think they take the easy way out. For example, on the licensing verification website or port of the website, I was looking for expert witnesses in a specific uh, specialty of care, like cardiology. There is no way to do two specifications of a specialist in cardiology. You can do a search for cardiologists, but you cannot do a supplementary filter for expert witnesses.
Yeah.
So I asked them, give me a list of all expert witnesses that are nurses. I did another question of, well, I used my proper verbiage, but I did it for cardiologists, and they pointed me to a link that gives you instructions on how to download the entire database of all the medical licensees. And I did it. But there are so many records that you have to build the database, because what you'll do is you'll get a table of licenses with the name, and then you'll get another table of specialties, and then you'll get another table of addresses, and there's a what's called a key record that kind of links all those like records together. And you have to rebuild this database on your computer. It's ridiculous. It's hundreds of thousands of records, if not a million. And it just made my computer choke. It was ridiculous.
Yeah.
But that was their answer.
Yeah. It seems to me like they have uh, provided what the law required them to provide, but they did it in such a way as to frustrate the average person so they would quit looking for what they were looking for, you know. And
Correct. Absolutely.
maybe once we get to the end of this trying to repeal subsection 8, maybe legalized negligence will want to take this on as our next project and get the lawmakers to say, hey, you cannot make this so complicated that the average citizen can't navigate this system.
Correct. Because I even tried downloading the search results for just cardiology, for example, and then downloading just expert witnesses and correlating the two. The thing I found out is, for example, when you do it based on the specialty, they'll give you first name, middle initial, last name separated. Under specialist, they will combine the first name and middle initial in the same field and then give you the last name. So you can't do a field for field search because the first field is no longer identical to the first field or the first name of the other record.
Yeah.
It is just, it creates so much processing that you can't do it.
I tell you what
And
this reminds I'll tell you what this reminds me of when there's a lawsuit going on and one side is requesting discovery from the other side. And instead of the other side giving them their discovery on a flash drive, they fill up a big truck with all the paper, the physical paper, and they deliver it to them. So they've given them their discovery, but they've made it next to impossible for them to sort through all of that and find what they need because, the hearing is tomorrow. So it
Yeah,
sounds like to me a deliberate attempt to try to frustrate your effort to get the data that you're looking for.
that is true. And what I would do to follow suit with that is the hospital where my mom was at, they gave me the records on paper, 999 to the T. They gave it to me on paper. If I have to give access to medical records to anyone else, I will go and make copies and give it to them on paper also. I will not sign a HIPAA release kind of thing. I'll say, I will provide them. There's no reason for a release. This is how I received them. It's how you're going to get them.
Yeah.
And a copy of a copy of a copy, multiplicity.
And,
Not that great.
and
But
I actually requested the paper copy of my mom's medical records because I'm old school. I like, flipping through the pages. But there were 1,600 pages to her medical record. And I realized very quickly, because back when I worked in medicine, everything had not become digital at that time. It was all handwritten notes and all that kind of stuff. But I learned very quickly that, man, if I had a digital copy of this medical record, it would make my life so much easier. So I requested a digital copy of it and I got it. First thing I noticed was that the page numbers were different. There were about 40 more pages in the digital copy than there were in the printed copy. I later found out that that was not really an issue. It just turned out to be the way that it printed. Um, but I was able to just type in my search terms and immediately find the thing that I was looking for instead of having to flip through hundreds of pages, and find it that way.
yeah, if I had to do it again, I would probably ask for the records in comma separated or comma delimited format
Mhm.
so that I could bring it into Excel and then I could use filters and just, manipulate it so much better than even a PDF that is searchable.
Well, let's
But
go.
getting back to the FOIA, um, here's where you get to choose how you want to receive your data. Electronic inspection on site, which you can go to a facility and inspect it on site. Copies on the CD, if you didn't want to create an account, they'll mail them to you. Might be a charge, which they can charge if it goes over a certain amount of workload or copies and stuff, pages. Regular mail, pickup copies. I guess if you have a building account, you don't need to fill this out at all. And you can upload additional information, like if you've already prepared your request, just upload it as opposed to typing it out.
Okay, now
Hit
FOIA
submit.
FOIA requests are specific to government, correct? If I
Correct.
wanted the medical record, I'm not filling out a FOIA request. I'm filling out a request directly with a hospital or with whatever company they have hired to archive their medical records. FOIA just is strictly when I'm trying to get something from government.
Correct. Correct. FOIA is government. You'll use HIPAA to get it from medical entities.
Mhm.
You okay, ACA. This is the public portal for ACA. Again, do a search for it. It's the public record search. This isn't a FOIA portal. This is just, I'm pointing out that you can do a search for publicly accessible records already. And I'll put one hospital in here, give you an example. Okay, I gotta type it out again.
So are you telling me that you don't really have to FOIA ACA because they've already made all their records available to the public through this portal?
No, they made some records available.
Okay, so there may be an occasion where you do have to send them a FOIA request.
Yes, I would say send the FOIA request and make them say no, you can't have it.
Okay.
Because otherwise they may only put certain reports out on the public when there's more that's available. They just aren't required to make it accessible.
Yeah, and
Just
again, we
like
use that
policies.
we use that to our benefit. Yeah, it's frustrating that they won't provide it to you, but now you've got some evidence that to show lawmakers that, look, I'm trying to get this information from the government on something and they're refusing to give it to me. So it's always good to document that stuff, even when it frustrates your attempt to accomplish what you want to accomplish. You're putting them on the defensive now.
Right. On this particular search, you see how this says settlement agreements
Mm-hmm.
right here, top one? That's what you want to look at to start with, because that is an agreement between ACA and the hospital to settle some violation of some kind. Some deficiency was found, and this is making it go away. I have found that a lot of things get settled for $1,000 because that's the minimum charge. It's a minimum fee. I found $9.35 million in one count on this particular hospital settled for $1,000, or I'll say less than 5,000. It was ridiculous.
Now, as aggravating as that is, it's like not even a slap on the wrist to the hospitals. Do we know where that money goes and how that where that fine goes and how it's used? So the state fines them, let's say $1,000, and so they pay the fine. Take it, it goes back to the state. Do we know how it's used?
No, we don't, but I currently have a FOIA with that very same question. I asked, they responded with a big spreadsheet with a bunch of account numbers. Of course, you don't know what the account numbers go to.
Yeah.
And I did a follow-up FOIA and asked for clarity, and I restated my question in another verbiage, so that they can properly reply exactly what I want. Because I excluded the investigation costs, because if you're found at fault, actually this wasn't with ACA, this was with Department of Health.
Mm-hmm.
If a respondent, that's the person who's the complainee, if they're found at fault violation, they will have to pay for the investigation fees, plus any punitive fees or whatever. So I asked them to separate the investigation fees, to not report that to me. So I hope to find out soon how much, violation fees exist out of a year's worth of Department of Health prosecutions. Oh, another thing, you want to go into these settlement agreements because they restate the issues found in the complaint that brought about the settlement agreement. And if the hospital is not giving you their policies, which they won't want to, you can often find a restatement of the hospital policy inside these settlement complaints. For example, I had an issue of telemetry with my mom's care. Hospital wouldn't give me their policy. So I kept digging back in history till I found a settlement agreement that had the telemetry policy for the hospital. It is a telemetry strip will be uploaded every 12 hours. And in addition to that, for every rhythm change. So I found violations based on that. I counted them up in the chart. They didn't have that many. So this is gold. If you're trying to dig, this is how you do it.
This is before you get into this next one. This is important for people to understand. We're aggravated. Number one, that the legislature wrote a law back in 1990 that prevents us from recovering damages, and so we're trying to seek justice in some way. And you look at all this stuff that Travis is explaining, and you're going, "Wow, that's a lot of work." Yeah, it is a lot of work. It's a tremendous amount of work. But if you're going to get justice, you're going to have to do the work to get it, because the legislature set it up to where you can't recover damages, which makes attorneys not want to take your case, because how do they get paid if there's no damages? So it's left up to you, the individual, to do the work, to bring the hospital to justice.
Yep. And you might save some attorney fees if you do have enough evidence to convince one to take a case. Let's say it wasn't resulting in a death, but someone survived, but they were injured. You might be able to show some more convincing evidence by finding data like this.
Yeah. And the fact that
Hillsborough County, go ahead.
I was just going to say that anything we dig up, we can always use as evidence to show the legislature what kind of changes need to be made in the laws. So go ahead. I didn't mean
to. And that's a great use of the FOIA, is because it allows you to receive on their letterhead, or through their portal, their response telling you what we can and can't do as an agency. You give that to your representative, and they're not taking your word for it. They're taking another government agency's word for it.
Exactly.
So they can't really refute it. Okay, this is Hillsborough County. I live in Hillsborough County. Come down here, click new request. Again, you'll need to set up an account because they're going to put the response in the account. They'll send you an email saying, hey, come check your account out. Hillsborough County's been really quick. I was very impressed with the speed at which they respond. I enjoy doing FOIAs with them.
Tell me what people would be requesting from their county.
Well, each department of county business, you can go to the clerk of the court. You can do, well, I guess the civil court side. You can, I guess FDLE will do the criminal, but also there would be the criminal court cases. The clerk's office for just taxes and stuff. You can request records. Of course, you can do searches on some of this stuff yourself, just on their website. But the behind the scenes things like the council meetings, you can get the minutes. You can get everything that was spoken about. Lease agreements, land purchases. It's all available to you. Pick your department, and then your request gets sent to that department. So I'm very impressed with Hillsborough County's. Very timely.
Just in case somebody who watches this video, if they're wondering, why would Travis want a lease agreement with a hospital? Do you mind going into why that was important to you? Because I think it's an important issue.
Okay. I am looking to do a federal 1983 suit on the hospital and doctors, because Florida statute 768.21 subsection 8 creates a disinterest for any attorney to take the case, because there's nothing but economic recovery by going through civil court. So there's no money to pay for a contingency lawsuit in civil court. It's not that I can't go to court. It's just there's nothing to pay for the attorney, so they're not going to take the case. So I was scratching my head, and I figured out that there's a 1983 civil rights avenue that if I can show the doctors and hospitals serve a function of government, then I might be able to go that route. So I started looking at the property. It's owned by the county. The county has the hospital. The tenant is the hospital brand that's leasing it. The lease actually shows the hospital equipment was part of the lease, and there was a sublease of a fire department on the property also that is kind of grandfathered in, will stay there. It keeps getting renewed. But then I started looking at mandatory reports that the government requires the hospital and doctors to file, which if they did not file it, the government would have to have an employee doing it. So since the government is asking the doctors and the hospitals to do it, they're standing in place of the employee. So I'm going to claim that they are agents of the government. Okay. So that satisfies the tie to the 1983 claim.
Okay, let me pause you right there. I want to recap that so people understand. The county itself built the building and they equipped it with medical equipment. And then they leased it to a private entity. And in that lease, there was a stipulation that the private entity, which we'll call the hospital, the medical functions people and all of that of the hospital, they have to perform certain obligations in order to fulfill their lease agreement with the government. Have I got that correct?
That is correct.
Okay, so what the government is telling them, in order for you to occupy this building that we built with tax dollars and that we equipped with tax dollars, you have to provide data back to us. And so you were able to show that by that requirement in the lease, the hospital became an agent of the government. Or
Well, the data going back to the government is not necessarily part of the lease. The lease is more of you will provide services for the good of the community.
the community. Okay.
The state licensing for the hospital via ACA, they require certain reports be filed, like inpatient reports and such, diagnostics, charges, things like that.
Mhm.
Doctors have to fill out the reports too. So those reports are part of the licensing of the physician, nurses, and facility, the hospital. So since the government requires that, I'm saying they're working for the government,
Yeah,
and you'd only acquire that data, but by servicing the patient. And if you're a Medicare, Medicaid patient, they're getting paid by the government also. So you got the physical location, you got the building, you got the action, providing the data and collecting of the data from the patient, and then you got the pay.
yeah.
How many more things do you need to show that they're working for the government?
Yeah, I just wanted to make the connection for anybody who watches this video, so, who would be going, what on earth does a lease for a hospital, have to do with, why would he be looking at that in a subsection 8 case? But when you lay it out, it makes sense. In fact, you
Mhm.
persuaded me. I mean, I've argued with you for weeks about that, saying, but you haven't proven to me yet that they're a government agent. And just within the last couple of days, you sent me an argument, and I said, I can't disagree with that. That makes
Yeah,
perfect.
you're a tough one to convince, but that's what I like about our communication is we challenge each other, and we vet our argument very well.
Well, and that's how it should be done, so that we know that our argument is strong before we present it to the government. And we still may get our backsides kicked, at some point, but we've done the best that we can.
Yep.
So, so this one is county. Is there anyone else that we might be sending FOIA requests to?
CMS, CMS, the federal side of things.
And that would
Uh,
be Medicare and Medicaid, correct?
Medicare, Medicaid, that is correct.
Okay.
Now, you can ask for what you want here. I can't say that you'll get a lot unless there's been an investigation into a complaint. I had filed a complaint, and I had found somewhere that if there's a complaint, you can ask about the the investigation. So I have a 212-page response so far. It's still going through redaction, but once that's done, I'm expecting to get 212 pages from CMS, which is huge.
And
Um,
there are so many people who fall into the subsection 8 category, um, who do get their medical bills paid with either Medicare or Medicaid. And so it's very important to know how to request information from CMS.
yeah. The other site is FOIA.gov. It's also CMS, but it's just another entry point. I'll say I don't know really what the delineation between the two is,
Mhm.
but it exists. So
Okay,
you
but
get to know about it.
let's make sure we be very specific here. We'll scroll back up to the top of the page if you would. This FOIA.gov is federal government. So anything that would come under the federal jurisdiction, which would be Medicare or Medicaid, that you would not go to this particular website requesting something from the state because it's a separate government entity.
Yes, but you may get information from the state because the federal government will commission the state government to serve some function. For example, I was trying to FOIA adverse incident reports. Now, the state of Florida will publish in aggregate all the incidences for Florida, but you can't drill down into it at all. They're protecting, hospitals and whatever. But when I tried to FOIA the report that the hospital submits, they Florida told me that they weren't the repository for it. So that told me that they must have pushed it up to the federal level to CMS. So you may be able to get reports at the state level at the federal.
Okay. Now, is
And
there
it's all about the repository. It's all about the repository.
who's
If you
collecting?
find there's data somewhere, FOIA.
Okay, is there a Florida specific website like this one is for the federal government? Or do you just go to each individual agency like Department of Health, ACA, Department of Children and Families?
Um, I can't say definitively.
Okay,
I think some state searches will send you here actually to this FOIA.gov.
okay,
I think that's one way that I got to here previously. Was that doing a Florida search in the link sent me here.
okay. Is it you and I have talked before about being the personal representative of the estate of the deceased, that gives us some authorities that we would not have, and we can compel discovery of certain documents and records and such. Is there any way that that is tied into a FOIA request, or can anybody do a FOIA request?
Anybody can do a FOIA request as long as they're authorized. Well, hold it. Yeah, as long as they're authorized for the data that you're requesting. For example, with CMS, with Department of Health, I had to send in proof of who I am, driver's license, letters of administration, things like that, because it's medical data. They got to know that I have a right to access that. Now, on the more general questions, like, how many complaints were there in the year of 2020? That's general. They're not giving PHI regarding that respect.
So, what
But
would make it
if you're
more
trying to,
specific?
well, it's like I was asking for the investigative report, in my complaints.
Or specifically on your mother? Okay, so because
Correct.
that's what.
I'll give you a prime example.
Okay,
I'll give you a prime example with ACA. They regulate facilities. So back in 2021, I filed a complaint with ACA on the hospital. They told me that they have 3 years to service that complaint. Well, I got tired of waiting, got towards the end of the 3 years, and I called them up and I told them I got to go before the judge. I need information. I found out about this federal statute that can compel you to do your job. You know, they said, well, give us some time. We'll see what we can do. I kid you not, within like 3 or 4 days, I got a call saying that the survey on that hospital was done. Now, the reason why I FOIA'd is, and I even did a HIPAA request, is I want proof that ACA actually did do the survey and that they're just not blowing me off.
mhm.
So the disclosures on the HIPAA request should tell me if the Department of Health or Agency for Healthcare Administration did the survey and accessed my mom's records. So that's one of the requests that I have going. I got a FOIA and I got a HIPAA, both going to see if there's a disclosure. Because if not, I'm going to take it before a judge.
And another, I think another benefit of this is it keeps the pressure on the hospital. You know, I think these hospitals and doctors are so used to people reaching a particular level of frustration, throwing up their hands and walking away. You know, and they may not ever give you what you want when all is said and done, but you can certainly let them know that they've been in a battle. You know, when they walk
Yeah.
away from it, they will know, I don't want to tangle with that guy again. And that's by constantly, I'm not talking about abusing the system, but using the system to let them know, hey, I'm still out here. You know, don't think I've gone away. You might not hear from me for 6 weeks, but there'll be another FOIA request coming for something else I've thought of. And you could just remember that I'm out here.
Yep. And, don't forget that HHS has an Office of Civil Rights, HHS being Health and Human Services. If you think that they're not fulfilling your HIPAA request, file a complaint with OCR and start an investigation. Give them the information that you found and let them run with it. I did that, and the hospital apparently reported to OCR saying they gave all the reports to me. Well, a later request, HIPAA request, revealed more records. Just happened to be printed out about a week ago, but the records show that they were last accessed or worked upon the night of or the day of, and up to 5 days after HHS closed their report. So I'm like, is that fabrication? Is it cover up? Don't know. But I have about 100 pages of new records that I never had before. So that's another HHS OCR complaint. Plus, I'm going to take it before the judge and show that, hey, they've concealed these records from me. I want 2 more years on my statute of limitations.
Yeah.
Because Florida statute 95.11 4C says if there's been concealment or fraud and such, you get 2 more years from the date of discovery. I just discovered it on 12/18 of this year. My mom passed away 2019. So that's 4 years. I got 7 years total to get on statute of limitations extended.
We've talked about this in other podcasts, but it is amazing how, and people don't think about it. A lot of times it's innocent. You know, let's say that a loved one dies on a Monday and some lab tests had been drawn that day. It might be a week or two before those tests ever get back, to the patient record department. People in the lab have no idea that the person died, so they continue to run the test. Then the lab results come back. So there's always some information that gets into the record after the patient passes away. And I bet we would all be stunned if 1 or 2 or 3 years after our loved one died, we requested a medical record again and compared the two. And I bet you a large majority of those would be different than the first one that we got. Just because additional information has been put in there. And like Travis is pointing out, if you were to do that and you found some new information that made you believe malpractice had occurred, that's when your 2 years starts. Didn't start back at the time of death. Started when you discovered the malpractice.
Right. And it doesn't even have to be malpractice yet.
Yeah.
It just is records, because you need the records to give to an expert to prove malpractice.
Mm-hmm.
That's the problem I'm in, is they're not giving me the records, and I can prove they're not giving me the records. So I can't say malpractice occurred yet.
Right. Right. Was there anything else? I know we've kind of gone over the limited time that we wanted to keep this short, but this was information that's necessary for people to hear. Is there anything else you think we should talk about with regard to FOIA?
No, not FOIA, just the wording of how you ask. You cannot cause them to create data. They can only give you what's already in existence. So you ask for documents sufficient to show.
And if you don't know what's already in existence, I don't think it would hurt to ask, and then they're going to write back and say that's not something that we keep records of.
Yeah, they'll say non-responsive.
Okay. And I would, like I always do, I would caution everybody, and, don't send a nasty, don't make your correspondence with them nasty. These are not people who were in the hospital. They didn't take part in your loved one's care. They just work in a building somewhere and do administrative stuff. Just give them the facts. You don't have to tell the whole story. You don't have to go into all this background and history. Just say, this is what I need, plain and simple. And the simpler you make it, the easier it is to get what you're requesting. Okay.
That is true.
Well,
I will tell you that buried in statute 119 of Florida Code, there is a release that you can execute on Department of Health. I don't know what it gets you because it's still in process,
mhm.
but it is more than what public records will give you. So I would submit that release along with your FOIA if you're trying to get any investigative jacket from the Department of Health or ACA. Provide them that release and see what it does.
Okay. If I can get you to stop sharing that screen, I guess we can sign out of here. There you go. Well, again, thank you for joining us. Like us, share us, tell your friends about us. And I already gave our disclaimer. We're not attorneys. We're just tell you the story of the stuff we've gone through trying to find justice for our mom dying. So,
Yep. Subscribe, hit the bell.
yeah, all of that kind of stuff. Have a good evening.